Ladies and gentlemen, welcome back to the program. Of course, you've probably heard that Dr. Oz is getting his own show starting today. It's premiering. Well, this is our best. This is the best we can do right here.
Well, we wanted our resident doctor, Dr. Daniel Kalla. Of course, he's an author and also an ER physician at St. Paul's. We always wanted him to come on in scrubs because we felt that it lent some authenticity. And his answer to that was,
no, you wear them.
You first. So here we are. I think it's going to have to be amputated.
Can you do that up?
Thank you. No, I can't. Hey, do you usually wear a T-shirt under this?
Sometimes, yeah.
So what do you mean sometimes?
Well, if it's a late weekend shift at St. Paul's, I don't bother. But if it's a more banker's hour shift,
if you're feeling a little more conservative,
yeah, exactly.
you put a little something underneath. Yeah. But otherwise, let your feet
they look charming on you. And
anything you want me to? Anything you would like to? Back injuries? Anything else?
Wow, it's really creepy when you know somebody's not a doctor. Anyway, today we were talking about the very serious topic of head injuries. Mm-hmm. We've all had them, and we all know what we're supposed to do when we have one. But let's start with Vancouver and cycling, because there are so many people out on the roads now with bikes, and some of them are still not wearing helmet. Maybe you can tell us why it's so important, Dan.
Yeah. Well, I mean, I was driving to work just a couple of days ago, and I passed a whole family, parents and kids who might have been 8 and 9 on bikes. None of them had helmets, and I was just incensed because the problem with cyclists is you're up against a bigger force, right? Yeah. You could be the most responsible cyclist in the world. There's nothing you can do if a car door opens in front of you or somebody clips you. Yeah. And it's just such a simple step.
Even if you fall over, it's there's nothing around you to stop your head from bouncing on the pavement.
Exactly. And you get one crack at this.
How many people do you see come through the ER, especially in the summer months when it's more prevalent and people are out there biking as a family, younger kids, high school kids, whatever it is? How prevalent and how often do you see people come in from biking with head injuries?
Often enough. I mean, I don't know what the numbers are, but we see them enough, and they're always way worse when they don't have helmets on.
Yeah.
And some of the worst head injuries I've ever seen have been cyclists.
Well, one of the stats that I read when we were getting ready for this is if you are involved in an accident, you are 4 times as likely to die if you're not wearing a helmet. Wow. That should be sobering right there. How much of a knock does it actually take to cause a head injury? Does it have to be something pretty traumatic, or can it be like
I mean, as I know Natasha Richardson is so topical right now. I mean, she fell on a bunny ski hill, right? It was not, she didn't fall out of a building. It depends on a lot of factors. It depends on the direction and mechanism. It also depends on the person. Are you on blood thinners? Do you have thinner bones? Do you, there's so many factors that are involved. So
say whether you're on the ski hill or on your bike, on a skateboard, what have you, and you do injure yourself, you do hit your head, what should you do? What is the first thing that you should do?
Well, I think it depends, right? If you have no symptoms and you weren't knocked out and you're feeling okay, I think it's reasonable. I don't think you need to seek help right away.
Right.
But there are a lot of warning symptoms. If you had amnesia, you don't remember the event, if you're nauseous, if you have a really severe headache, or if people notice anything different about you or your personality, it's time to get to the hospital.
Anxiety can be one of them as well.
Yeah, exactly. It can be very subtle.
What about kids? Because, we both have kids. Yeah. I have young kids, one of whom's going to be learning how to walk soon. And it's always a pretty crazy time because they do crank their heads sometimes, right?
I
mean, it's the heaviest part of their body, so there it goes. So, when you have a kid and their state of consciousness isn't that well developed yet, how do you know when they've hit themselves hard enough that you should be? I mean, can you tell those?
I think, with toddlers and stuff, and as you say, it's so common with them, I think you should err on the side of caution. If you have any doubt, I think it's worth seeing a doctor, going to emergency. Yeah. I mean, good signs is if they cry right away and then see them themselves and they're able to feed and they're not, particularly irritable. And, there's times you can tell that it's pretty minor.
So loss of appetite's a big one to look for, and loss of consciousness.
What is a concussion, and how do you know if you have one?
Well, it's sometimes tough to tell. I mean, a concussion is basically, an injury to the brain where there's not specific bleeding. The brain floats. It sits in this gelatin thing and floats inside the skull.
That's gross.
I know it's gross, but it's important. You don't want it fixed to the skull. So, but, if you bang your head, it moves around and shifts, sometimes bumps up against the skull. Sometimes it just rotates and turns, and that enough in itself is enough to cause a concussion or injury. So usually the typical thing is people usually lose consciousness, though not always when they hit their head, and they have symptoms afterwards of headache, nausea, poor concentration. I think all of us can relate. Seeing stars, all those kind of symptoms we've all had to some degree. Those are all concussions.
Could
And
it ever
don't
make
go to
you
sleep.
smarter?
Yeah, no.
I mean, because I've hit my head a couple times.
I'd be a genius.
And I just wondered whether maybe it helped in
No.
some ways.
I don't know, it's a good long-term strategy.
But it can cause all kinds of things. I mean, like you mentioned before, it's such a complex mechanism, and it doesn't take much to sort of throw that off kilter.
Yeah. So, concussions themselves can be, repetitive concussions can be lethal. We see what happens to boxers who get concussed enough.
Football players.
And football, hockey players and stuff. So that in itself is a risk. But what we get more worried about the emergency is bleeding between the skull and the brain. If the skull is broken, and even if it's not broken, you can get what's called these hematomas, epidural
How
and
long does it
subdural.
take for that? Like, is it a matter of hours, minutes, days?
It can be anything. Depends what's bleeding. If it's an artery, again, getting back to Natasha Richardson, because we've had a run in the emergency ever since her, the tragedy that happened to her. But she had what's called an epidural hematoma, and usually that's from a lacerated artery between the skull and the brain, and those bleed really quick, right? And so the blood accumulates, and at first you feel, people often with epidural hematomas feel okay for minutes to hours because they have a headache, but it's not until the pressure builds so much that the brain is pushed down and
that you really start seeing those symptoms.
and then it's often too late.
So is there a slow version of that?
Exactly, because sometimes, more often, it's a vein that's bleeding in the brain, and that can bleed quite slowly and accumulate over time. And so often they'll have symptoms right away, but the symptoms won't get bad for up to a couple days after.
And if you do have a concussion, don't go to sleep.
Is that true, or is that an old wives' tale?
At some point. No, I think once you've
Well, I
been checked
remember
out.
leaving the hospital, they told somebody should wake me up every few hours just to make sure.
That's kind of gone out. We don't do that as much anymore. I mean, if we're worried enough at the time, we'll do imaging like a CAT scan or keep them in a hospital, right? Usually we don't, Although if you want to terrorize a university
So they were
buddy, or you
terrorizing
just
me.
wake them up every hour.
I told you doctors were mean.
Dude, you fell. You have to wake up every hour.
But it's really not. It doesn't make a lot of medical
But if
sense.
you black
Usually
out,
there's
go to the
signs.
hospital.
Yeah, I think if you black out and you're not 100% right, absolutely you should go to the hospital.
Well, and you mentioned it right off the top, and we're going to transition and talk about your work as an author, but take precautions before these things happen.
Yeah.
Wear a helmet when you're on your bike. Wear your seatbelt. Take precautions when you're in these situations.
Yeah, I know Fiona was just mentioning, if you're an adult, I guess it's your choice, although it is the law,
It's
right?
the law!
But with kids, it's just
Well, I'm
unforgivable.
not going to turn around and yell at an adult for not wearing a helmet.
Yeah, but what would happen if something happened? How would you feel for the rest of your life if your child got injured because they weren't wearing a helmet?
Yeah.
I don't
Makes
understand
no sense.
Well, you've got a new book coming out, and we can officially reveal the new cover, the title of Flesh and Blood. It sounds really happy. What's it about this time?
It is. It's all.
This is very different for you. This is sort of a...
It's a departure, yeah. It's a sort of a big epic family saga. It's set in the Pacific Northwest, kind of a fictional Mayo Clinic, and it goes 100 years back to its founding and to the present, and talks about this family, this medical family has been involved right from the start, and they're in crisis, and the hospital's in crisis. And it's a good hospital. It's done a lot of good charity and important research work, and they sort of all these crises meld, and it was really a chance for me to explore characters and storylines, even do a bit
when
of
is it coming
historical.
out?
April 2010. April
Can't
13th.
wait.
Yeah.
I'm sure we're going to have you on many times between here and there.
Yeah.
And I think the segment went
great.
better because one of us was wearing scrubs.
I think so, too.
I think if two people were wearing
It would
scrubs,
be too much.
Even better.
No,
Too much?
It would be too much.
Really?
I think so.
What
Really?
about if
Maybe
you
next
throw
time.
Oh yeah.
Maybe next time.
As long as you two are the ones wearing them.
Thank you so much. You can go to Dan's website to find out all the information about his new book, which is coming out in the springtime. We're going to take a quick break, and when we return, Buzz Bishop is going to be here, and he's going to be telling us how you can pimp up your dorm room.
All right, let's check out that knee.